So, okay, let's talk about MDMA. When a lot of people hear MDMA, they think of Molly or ecstasy. So just a real quick point on that. I want to set the record straight. And all of this is directly from the National Institute of Health, the NIH. MDMA is a synthetic drug that acts as a stimulant and hallucinogen. It produces an energizing effect, distortions in time and perception, and enhanced enjoyment from sensory experiences. It has also been described as an entactogen, a drug that can increase self-awareness and empathy. So MDMA is a synthetic drug, and the pure form of the drug is called MDMA. But what about ecstasy or X? Ecstasy is most often taken in a pill form. It's a tablet or it's a capsule. But a lot of the time, ecstasy has other stuff in it like meth, ketamine, caffeine, ephedrine, heroin, PCP, cocaine, etc. So is X the same as MDA? Probably not, most of the time. So I'm sure it's possible, but we're talking about purely formulated MDMA, which will eventually be medical grade. Not eventually, it is medical grade right now. It's in trials, but ecstasy is not, guaranteed or even typically medical grade MDMA. Mm-hmm. And Molly, what about Molly? Molly is slang for molecular. So it refers to the crystalline powder form of MDMA, and it's usually just sold as a raw powder or in capsules. And most people who know these sorts of things tend to think of Molly as most people tend to think of Molly as a more pure form of MDMA compared to ecstasy. But Molly can also contain a bunch of other stuff. So neither Molly nor ecstasy should be considered pure forms of medical grade MDMA, which is what we're talking about today. So I just wanted to make all that clear. And by the way, interesting thing I learned. Do you know where most MDMA consumed in the United States comes from? Canada. MDMA.
Wow, I did not know that.
I was shocked. MDMA is illegal in most countries, including the United States, and currently has no approved medical uses. But the FDA is currently evaluating the drug for clinical use. So, Faith.
That's right.
You have a stellar reputation in work tech. Your previous company, Collective Growth, was well regarded and helped a lot of companies. You also have this amazing experience in the financial services industry and in retail. You have a bachelor's and a master's degree in social work, and just for good measure, you have an MBA. How in the hell did you find your way to MDMA assisted therapy?
Oh, nice introduction to that. Which, by the way, I don't have my MBA yet. I am enrolled, but I am a certified integral coach.
MBA candidate.
Thank you. Yes. Okay, so how did I find my way to MDMA? Interesting story. During my undergraduate work, I started an independent research project on human potential and post-traumatic growth through the lens of a social worker. This was in 2019. It was also, I could fill three courses with one independent research project. And I thought, that sounds amazing. And I need to research human potential. I'm calling myself a human potentialist. I should go deep down the path of understanding human potential. And I also want to understand post-traumatic growth, which isn't it interesting that the pandemic had not hit. And I started looking into what post-traumatic growth, what is it? How does it have an impact? During my studies, the human potential movement started in the United States. I mean, you could look at philosophically and go back thousands of years, but I'm just looking in the context of when, they say the human potential movement started in the United States at Esalen, mostly, Esalen Institute in Big Sur. It started in the 1960s. And you probably will find a name very familiar that most people will know, Timothy Leary, who was a professor at Harvard. And there's LSD. There's a product. Obviously, he's the father of LSD in many ways. He was teaching at Esalen with people like Aldous Huxley and all of these incredible Carl Rogers and these incredible thinkers and teachers. And I'm studying what human potential is through all of these people. And all of a sudden I start to see the forward path of how the criminalization of drugs. So we started in the 1960s during the human potential movement. There's this love and peace experience. They call them the hippies, and they are trying to create a better world. Then we have Esalen Institute, who's teaching around human potential and has some of the greatest thinkers around human potential. Then you have Timothy Leary, who takes LSD with his students, and the FDA swoops in, and we start to criminalize drugs. We start to see this uprise in use of psychedelics. And I have my theories on why it was criminalized, but Nixon declares war on drugs, and these psychedelics that were shown to improve mental health and outcomes. And MDMA started as a therapeutic drug. It was not. It got out of the therapeutic circles, and it was then called ecstasy as a party drug. So we're seeing this movement of human potential and ways to self-actualize, and there's also mental health benefits to these psychedelics. And we declare war on drugs. We criminalize these drugs, and
well, you can't say, well, I have my theories on why we criminalize drugs, but ... So what are your theories?
Well,
we can always cut it in post.
Yeah. Okay. Well, I feel like it's a way. If we don't allow people to self-actualize, if we're looking at, and you don't have to use a psychedelic to self-actualize. So let me just be very clear about that. But if there is a greater access to an altered state of consciousness that allows for healing or self-actualization or personal growth or increased mental well-being, which obviously there's a bunch of research around it, like if we don't allow access to that, what are we doing? We're oppressing. We're keeping people sick. We're keeping people stuck. We're not giving people access to plant medicine and to other medicines that are actually proven to reduce post-traumatic stress disorder after a few sessions. MAPS, the Multidisciplinary Association of Psychedelic Science, they're in phase 3 of clinical trials. So I guess my point is, why
do you think this is a government thing or a pharmaceutical industry thing, or like if we're trying to keep these therapies out of the hands of people, it's either for control or for profit, right? So what do you think is the root there?
Yeah, or both.
Yep.
I think there's both. From a policy or government perspective, when MDMA was criminalized, the FDA didn't know it was a therapeutic drug. They only knew it as a party drug. And so I want to, I'm of the nature I want to always assume the best in people. I don't like to go down the rabbit hole of like how bad things can be and corrupt. Although I do believe there's a lot of corruption, obviously. But I think it's both. I think the FDA swooped in for their reasons, to get this drug off the streets. Then we have, we talked about this, Bret. I think there's modern day slavery and this, like, how do we criminalize something that can keep people in a system and keep people, look at cannabis. Come on.
Reefer madness. You have to go back to the reefer madness campaigns, run in the 50s that were trying to criminalize marijuana. But my master's is in criminology, and so a lot of what you're talking about, resonates very deeply with me, because systemically there are, you just have to, think about like the different laws that were passed to prosecute crack versus powder cocaine, because crack was,
and where does crack mostly exist?
Used by African Americans. And it just became, we've got 7 million people incarcerated in the United States. The vast majority are African American, on and on and on. So, you're preaching to the choir here. telling Noah about the flood when it comes to making decisions about things that could be helpful for people and trying to keep them out of other people's hands. But I interrupted you and you were talking about how this journey of, the human potential movement.
Getting to where I am,
led you to incorporating this into some, a journey that you were already on. So this is this is the interconnectedness that you were talking about, right? Like all this stuff's coming together.
Yes. So I recently, after learning about that, I thought, well, this is really amazing. And then I've just continued to research and follow MAPS and Johns Hopkins. And of course, they're focused on psilocybin, but I'm following these researchers all the while. I'm focused on cultivating potential and elevating humanity in the workplace. I'm focused on liberating and empowering the human spirit. I don't say using psychedelics. I am focused on how do we create. So there's the advising side. And then I thought, what am I here to do? If I say I'm here to liberate and empower the human spirit, what does that mean? And then I started reflecting on my life growing up. My mother has bipolar disorder. My sister has bipolar disorder. My father had untreated post-traumatic stress. I grew up and am exposed to and genetically predisposed to mental health disorders that can dramatically impact my life. And that did dramatically impact my life. And it has dramatically impacted my family's life. And why wouldn't I just started seeing, okay, it's human potential. There's this feeling of growth and love that we all want. The root, the undercurrent of being a human being, the human condition is love. Like, we are here to be interconnected. We are here to provide and contribute our talents and energy and gifts to the world. And some of us don't have the capacity to do that or the access to do that because they are stuck in a state of mind and a state of consciousness that has paralyzed them in ways to be able to move forward or to contribute. Or maybe there's a mental pattern that stops them from being able to continue to advance. And I believe that happened to my family and so I'm just seeing, like, there's such a connection. And where do we have the widest population, the largest population of people that we can impact? In the workplace. So I want workplaces to start, if they aren't already, like, once this is MDMA is FDA approved, and the research on it is so profound. I mean, I'm just really blown away by Rick Doblin's work and his team's work. But once this is approved, insurance companies have to underwrite this into their insurance. Like, employers should start adopting this as part of, not should, I don't want to say should. The invitation is for them to consider how they can give their people access to this now this isn't, I'm not saying everybody needs this at all. I'm talking about a therapeutically assisted psychedelic experience. If people are experiencing mental health conditions that have stopped them from being able to experience, they're stuck, we should have access to these drugs that provide a access to a different state of consciousness that helps us heal, that allows us to connect to our inner healing wisdom, so we can show up and contribute in a really meaningful way. And I was gonna
I love your answer, because to me it's like, okay, so we haven't cured cancer, right? Cancer's not cured, so we keep trying. No one would say, hey, let's not investigate a cure for cancer, right? Because the job's not done yet. Clearly, we have not cured mental illness. We have not cured PTSD. We have not cured depression. We have not cured any of these things. So why would we stop scientific discovery and trying different avenues until we can get a handle on fixing these problems that destroy people, families, communities, that make it so hard for so many people. So. But there's still that that stigma. It's like, is it even really a real thing? Is PTSD a real thing? So I read about 15 academic articles from medical journals in preparation for this. And there's a big, kind of debate around, there's no debate around MDMA. So I'll just read this real quickly and then I'll kind of get to the debate. The most reputable medical journals in the world, like the New England Journal of Medicine, the Lancet, the Journal of American Medical Association, and the most reputable psychology journals like Psychological Review and American Journal of Society have published peer-reviewed articles on the efficacy of MDMA for various disorders. One article I read in Nature reported the findings of a randomized, double-blind, placebo-controlled, multi-site, phase 3 clinical trial test. Boy, that was a lot. I bet a lot of people understand a lot more about what that means after COVID than they did before COVID. That's a serious trial. That's a phase 3 clinical trial to test the efficacy of MDMA for the treatment of patients with severe PTSD, dissociation, depression, substance use disorders, and childhood trauma. And here is a quote from that article. These data indicate that, compared with manualized therapy with inactive placebo, MDMA-assisted therapy is highly efficacious in individuals with severe PTSD, and treatment is safe and well-tolerated, even in those with comorbidities. We conclude that MDMA-assisted therapy represents a potential breakthrough treatment that merits expedited clinical evaluation. And all the journals pretty much back up that same position. I mean, you're not surprised by any of that, right?
Yeah. Yeah, no, but I get so much joy out of hearing it every single time. It makes me smile.
But this stuff all sounds pretty heavy, right? Like these are heavy conditions, PTSD, stuff like that. How does MDMA-assisted therapy fit into the workplace? And the reason I brought up the controversy is because I was going to ask you, do we have PTSD from COVID? And this is the debate that is raging in the academic journals right now. It's like they're getting really specific about, okay, well, PTSD is defined as,
of course,
it has to be an acute episode where, death was possible. And so half the people are like, no, this is totally PTSD. And half the people are like, no, this isn't PTSD at all. It doesn't meet the clinical criteria. And so, if I'm just trying to make this connection of if, right now MDMA is, basically be considered, is being tested as a very serious treatment for some very serious, mental health issues. Yeah. Do we already, have a larger manifestation of those very serious issues because of COVID going on in the workplace? And how does, everything that we just talked about, how does that work at work? Does that make sense?
Oh, yes. I'm trying to pick where I want to start. So first of all, the definition, words create our reality. If you have a strong enough perception, or if you go down a certain path, you can argue against anything. You can always take a side. You can always take a different perspective. And that's the beauty of multiple perspectives and, diversity of perspective and neuroscience diversity. What I will say about post-traumatic stress, and from research that I've read, from work that I've done, I've focused on post-traumatic growth, not post-traumatic stress disorder. But post-traumatic stress is anytime you do not have the capacity to be, you don't have the capacity to be with reality anymore. It doesn't, if you can't move from an experience and you stay in that experience, because somatically and physiologically that stress is stuck in our bodies, which then impacts our mindset. So post-traumatic stress doesn't, yes, veterans, our military is probably the prime example of where this all started, but post-traumatic stress can absolutely be more than what you described as or the clinical definition of it. It's anything that stops us from being able to cope and no longer
what's
cope.
The difference between,
and the pandemic has broken that, has impacted us so much.
What's the difference between PTSD and post-traumatic growth?
Yeah, well, post-traumatic growth is actually the ability to reframe, not the ability, it is to grow from the stress, to thrive, to turn a crisis into a calling, to see the deep lessons of that crisis, of the stress or the trauma, to work through it in a way that it actually helps you grow and continue to move forward in life. So it's basically taking adversity. And we started off the conversation. It's like, how do you take what's happening and turn it into something that we can learn from and we can grow from and evolve? So we are growing from the pain and the trauma. Of course, that takes, different modalities and it's different time for everybody. But post-traumatic growth is, what did I learn from this? How did it change me spiritually, mentally, physically, emotionally? And how am I going to move forward with this as a way to even contribute to the world in a better place, contribute to the world in a more meaningful way?
Well, Yale did a meta study where they looked at like 36 different studies on MDMA and its use in psychedelic assisted therapy. And they basically speculated, they didn't speculate, across these 36 studies, they said the average projection for how many people had experienced trauma just before the pandemic, just walking through life every day, that about 26% of people have experienced trauma of some kind. And that was previous to the pandemic. So in your work, it seems like there really is. Like, I was curious going into our conversation whether the MDMA assisted therapy was really driven towards trauma in, that integration phase that you're talking about and, bringing all this stuff together. Was it really about a trauma or was it a wider net that you were casting? But it does sound like you are a pretty, it sounds like you're focused somewhat on the connection between, the use of this therapy and trauma. And what percentage, like, if you just had to guess, like, how many people have you come across in your conversations that you suspect have experienced some sort of trauma and that's impacting how they, walk through life and interact in that environment that you're talking about inside the organizations that you're brought in to help?
My honest answer is everyone. Like, I would say the people that I work with now, some people are really good at like not showing it or talking about it. Every single person, if anybody told me they have not been changed by what is happening right now, I would say that's wake up. You're not awake. If you haven't been changed in some way, or have experienced just some life-altering, whether good or bad, experience from this, because it's not just about the pandemic, and we know that this is systems of oppression breaking. I mean, this is all of the isms that are coming at racism and sexism. We had the Me Too movement. This is all back-to-back experiences. The Black Lives Matter, these massive, these monumental social constructs that are being ripped up. I mean, we're tearing everything apart right now. Things are crumbling. And then we added the COVID. Yeah. Like, this isn't just COVID-19. That actually is the straw that broke the camel's back. Like, we have a cluster of events that are happening that are hurting people deeply. So if anybody says they haven't been impacted, or, so I guess how this all plays out into the employee experience is, we have a responsibility as leaders of organizations, as people, whether you lead a team, we all lead ourselves, but whether you lead a team, you run a company, you are a policy maker, we have a major responsibility to respond to the needs of our people right now. And those needs are deep. And it's not, not only are we healing or creating a space where people can heal so they can perform too, but we are reshaping the future. And we need to listen to we need more voices and advocacy and listening to people who are saying there's a better way to create a future. We have an opportunity to rebuild, and let's listen to new voices and new perspectives.
Well, anyway. So what I think I heard you say, and I'm going to paraphrase, I'm not going to use your exact words, but I think I heard you say that companies bear a responsibility for the mental health of their employees.
Yes.
How many people? No, it's perfect. I want to put a fine point on that. How many people do you think agree with that? And I'm not talking about employees. I'm talking, how many business owners or executives do you think agree with the position that companies have a responsibility for the mental health of their employees?
I would say if they don't agree now, then they have no employees. So whether they agree wholeheartedly and in their intention or just say like, oh gosh, I have to agree because this is the way the world is going. If they don't agree, they're in a really bad place right now. In my opinion, they're not as in an optimal state of ability to be innovative and creative and wow their clients. Like if your internal stakeholders, your team members, your employees are not well, nothing else. I'm not sure what else works. So I hope. I don't want to, I hate to sound like it should be this way or that I want to like demonize anybody. What I want to say is we have the opportunity to absolutely adopt the mindset that we have to be stewards of human development, that we have to take on this responsibility as leaders to respond to the needs of our people. I
agree. So first of all, I think that, companies have a tremendous responsibility. And what I'm really tired of, what drives me nutso is but it's also good business. So like, when do we get to stop convincing people that it's good for business and that's why you should do it? It's like, you know what? It actually is good for business, but that's not why you should do it. You should do it because of the tremendous sacrifices that people make every day just working jobs for companies. I mean, the value, exchange is way out of balance, and you should do it because it's the right thing to do, not because exclusively it's a means to an end. But what are you gonna do?
Well, to answer that, Bret, like this is a inner question of ourselves. Like, what do we believe is right in the world? Or what do we believe as leaders, which then informs the policies that we create in our organizations, our HR policies, our benefits, our compensation philosophy. Like, it's all driven by what we think about the world and what we think about people, about humans. And so the great companies who believe this, which is, hopefully more and more continue to emerge. You are one of those companies and people that believe this wholeheartedly. So I think the convincing is, for me, which I would say like everybody needs a therapist or a coach. Like, when we go inward and we do our own work, then it's only natural for it to come outward, and that we start making decisions from a heart-centered place and from a place of we're all interconnected. If I hurt you, I hurt myself. And there's a great, of course, there's research out there. Like Firms of Endearment is a great book that talks about how investing in your people has a great return on so many levels. Conscious capitalism focuses on a multi-stakeholder approach. There are other philosophies out there. Otto Schamar, I don't know if I'm pronouncing his last name correctly. He's a professor at MIT. He wrote a book called Leading from the Future That Is Emerging. So how do we, there's research out there, although executives aren't going to want to read a bunch of research. And I think we just have to continue to create platforms for people to have a voice and create a ripple effect in change by having these conversations. But it starts in here.
I totally agree.
Oh, wait, by the way, so Chip Conley, who is the founder, he was the founder of Joie de Vie, hospitality group, which was purchased later down the road by Hilton. And then he was the hospitality, he oversaw the hospitality experience at Airbnb at a very early stage. The founders, he was very early. Do you know Chip Conley?
No.
Have you heard of him? Okay, so he wrote a book, many books, but one of them is called Peak: How Great Companies Get Their Mojo from Maslow. And he's operated like this his entire, he built a company around Maslow's hierarchy of needs and translated it into the customer needs, the employee needs, and the shareholder, the investor's needs. But one of the coolest things that his book starts out open with is Maslow stating that mass therapy it was related to mass therapy, and the business world was the most efficient and profound way to reach people. Let me say that again. I feel like I butchered that. Mass therapy and the business world was the most efficient and profound way to reach people. So we're saying there's a built-in
Yeah.
audience. Like, we've got these humans in this environment. Let's help them. And Timothy Leary, Chip Conley actually had met Timothy Leary at one of his hotels. And Timothy said to Chip, business people, although he said people will probably hate that I'd say this because he's talking about business leaders, and that obviously wasn't his focus, but business people have the greatest potential to transform the world for better. Timothy Leary said that.
Not surprising.
Yeah.
But you're right. And the other side of it is not just access, but also, most employees, and especially in large workforces, are in a position where they have to be open to feedback. That's like part of the gig. Like in your personal life, you can be totally shut down when it comes to feedback. You're not going to last in a job for very long if you were totally closed down to feedback.
Okay. Yes. Can I
Please
say
do.
something? I just cut you off. Okay. If we have to be open to feedback in the workplace, and we can actually cultivate the ability to like hear feedback and integrate the feedback and make the changes, imagine how we would show up in our relationships. Imagine how maybe we become better parents because of it. Maybe we become better partners or community leaders. But this is the interconnectedness, is like, if you want people to, anyway, you shape people's lives, and it can have a positive ripple effect.
I totally agree. I mean, I do believe that a good job can change people's lives, and in so many ways, including just how they walk through life and how pleasant they are to be around, and how effective they are at developing and maintaining relationships. If you have a commitment to people and you stick with it. And I say that as a deeply flawed human who is surrounded by people much better than myself. A couple more questions on MDMA. So walk me through it. What does the timeline look like here before, there are, well, for you and because even if you can't be ready because the world's not ready yet, right? When does all of this stuff converge? How long before I, as a vice president of human resources or benefits in a large company, can recommend to, my, executive management team that we partner with a group who, among many things, also provides access to MDMA or psychedelic assisted therapy? How far away are we from that?
Mm-hmm. Okay, so there's two ways to answer this. The first answer is from a clinical perspective for therapists, for clinicians in a private practice. MDMA is projected, and I just listened to a podcast with Rick Doblin, and I think this was just in December that he was on. And he is projecting, based on phase 3 clinical trials and the statistical significance of these trials and the outcomes, that the FDA could be ready to approve by mid to late 2023, early 2024. So that's when it's coming to therapists and clinicians. And of course, you have to be trained in psychedelic assisted therapy. Now, your question about when I think the available, or when is the question when I think workplaces should be ready or when it should be coming to workplaces? Because what I have to understand, or what companies have to understand, is you're going to have to work with, insurance companies are going to have to change. If they are going to approve, this is an FDA approved drug, and I can get this from a clinician, a trained clinician, then, and I don't want my employees to have to pay, a large amount for this, or maybe I cover the copay, or I cover it completely as part of their benefits package. That is probably a much longer process because you're going to work with these insurance brokers. And first of all, we don't even have, most insurance companies don't write a lot of mental health in general. Access to mental health and behavioral health has been so undervalued compared to medical benefits for so long. We have not ever invested. I mean, this is just in the late 2000s that we actually started underwriting mental health and behavioral health. So now we're going to add psychedelic assisted therapy. So that's probably a little bit longer, but I do think companies can start having conversations now about their, are we going to offer this as part of our insurance plan, or, who are the insurance brokers out there that are having this conversation? What is our perspective on it? Because there's a resurgence globally right now. And so people are going to want access. These are people working inside of organizations that have bipolar disorder or depression or post-traumatic stress disorder. Now, I think the focus will likely be on different populations of people when this drug is available. Like, these are much like the clinical research on veterans and depression. So I think they'll probably phase it in different populations. So I don't know about the employee population, but I think it.
Well, in large companies, what's probably going to happen is eventually it'll be part of all the well-being companies who work with very large customers tend to focus the majority of their time on the highest risk portion of the employee population. So they'll use a health risk assessment or something like that to find people who are at risk of diabetes or metabolic syndrome, or, hopefully in the future, PTSD or, whatever. And then treatment will be targeted at that portion of the population. But let's take all the insurance stuff off the table and the complexities associated with that. I'm just a person who has a business and employees, and I believe in it, and I'm willing to pay for it. I don't care about insurance. How soon before I can recommend or say yes to someone who requests it? MDMA assisted therapy. How long before that's a reality where we can just make that happen?
Well, so they'd have to go to a clinician, and then the clinician would provide the diagnosis. Like, you have to have the condition in order to be treated. To use this drug encapsulated in therapy. So if you're asking, like, I'm Bret, I have an office in Fort Worth in California, right?
Yep,
is it California?
So. Yep.
Okay. Then my answer would be, first of all, obviously when it's FDA approved, but you'll have to find clinicians in your area, or you'd have to find clinicians in your area, and then tell your team, hey, if you are, obviously there's HIPAA, and you can't talk to people about their medical conditions, but you can say, as a company, if this is a treatment that you are seeking and you find it meaningful and you go through the process, then, you could just pay for it.
It sounds like to me, you mentioned the date, FDA approved probably, 2023, 2024, based on some people's projections in the industry right now. It sounds like for a while it's probably going to fall under a lot of important and desirable, kind of treatments, but not become part of the corporate culture immediately. And so, I might be able to recommend to someone at work that they see a therapist, and even give them a referral to a therapist, but that's different than having like a therapist on staff, or having it part of, the integrated, kind of like, a lot of big companies, for instance, have clinics inside their offices where people can get flu shots and, get treatment for, minor ailments. But not a lot of people have, a therapist on staff or, et cetera. And so there still seems to be this bridge that needs to be built between what is possible and available and what companies work hard to make sure is available to their people.
Yeah.
And it sounds like that's just going to be an ongoing conversation that we need to keep having.
Yes, absolutely. And part of the thought process for me is there's like clinical work that I'll focus on, and then advising work that I'll focus on. And I know we talked about like how does this ultimately get blended? But I think the best thing companies can do right now is eliminate the stigma around therapy, is to work toward telling their employee population, whether it's coaching or please use our mental health benefits, please use, seek help when you need help, or advocate for mental health services, that's the first step, because then you start to say, like, this is all okay. Whatever therapy you get that is provided by your clinician is your work to do. Know that as a company, we believe in it. We wholeheartedly support your mental health, and that we have benefits, so you don't have to pay, out of pocket, which a lot of therapists are. There's therapists that take insurance, and then some are out of pocket. So anyway, the basis is start now by making mental health matter in your workplace.
Great points. It was a real pleasure speaking with you today, and I'm going to end with a question that you brought up that you use. You brought it up earlier, and you use it when you're trying to integrate the findings and the results from the work that you do. So how would you want people to feel after listening to or watching this podcast? Did I ask that right?
Yeah. How would I want people to feel? I would want them to feel inspired, hopeful, intrigued, like curious. I hope they feel that it was a meaningful, their time was well spent in a meaningful conversation. And I hope they feel this energy to take some sort of action. It doesn't have to be to call faith and let's talk about this, but I hope they start to percolate and really deeply think. I hope they feel like this is something that I need to think about and consider. And this is really interesting. And I'm hopeful for a better future. And
so who should reach out to you?
Well, HR leaders. I work with founders. This has been my client list, but HR leaders usually reach out to us first. Executives or people on some sort of leadership team that might be overseeing a business unit or a major strategic initiative. Somebody in the C-suite or founders.
And why should they reach out to you?
Because there is a new future that is emerging, and we have to meet the needs of our people, and they have a massive opportunity to lead with love and to support human development. So if they want a better future and a better workplace and retention and attraction of top talent, and they believe they have a responsibility to support human development, and they're excited about it, then that would be why.
Really, the last question then, how can they reach you?
Oh, good question. So you mentioned my website earlier, which is www.tulla.love. And it is, I will just put it out there that it's not complete. So we will be working on making some updates over the next 2 months. And Tulla, by the way, means become in Finnish. So it's become love. Or you could email me at faith@tulla.love. And I would love to just talk.
Awesome. And you can't forget tulla.love. And in case you forget the email address, there is a contact form on the website. So people should be able to get in touch with you. Thank you so much for your time, Faith.
You're welcome. Was this meaningful for you, Bret? How do you feel?
Fantastic.